I'm Lauren Andrego in for Amy Hawkert this afternoon, and we want to check in with the Minnesota Department of Health. We do that periodically on this show. But first, let's rewind to late last month. The CDC announced it would pull back about $11.4 billion in public health grants, which were allocated to state and local health departments as part of the COVID-19 pandemic response. That would have meant that $226 million granted to the Minnesota Department of Health would be terminated. But as of last week, on April 4th, a federal judge over in Rhode Island temporarily blocked these cuts nationwide. But now the future of these grants are up in the air. Dr. Ruth Lynfield is the state epidemiologist. She is also the medical director for MDH. She's here to break all of that down. But first, we have to talk about a couple other health headlines that we've been, talking about for weeks and months. Dr. Lynfield, so nice to meet you. Thank you for being here today.
Thank you for having me.
Well, we are hearing about measles outbreaks in regions around the country, particularly in Texas. It sounds like right now, according to our dashboard, things are doing okay in Minnesota. Tell me a little bit about that, and also our help in Texas, how Minnesota is helping out the efforts in Texas.
Yeah, absolutely. Thank you for the question. Well, we are seeing a vigorous uptick in measles. And as folks probably know, there's a very large outbreak. This year it originated in Texas, spread to New Mexico. There are now 22 states that have reported cases. Not all the cases that have been reported are directly associated with this outbreak, but certainly most of the cases in Texas and New Mexico, and possibly some other states, are. And what happens is that measles is still circulating in many parts of the world. In 2000, in the US, it was declared eliminated, which means that there's not ongoing year-round circulation. However, if people go to a part of the world where measles is circulating, and if they are not immune and not immunized, they can become infected and bring it back. And measles is so contagious that if someone who is infected with measles is in a room with 10 people who are not immune, 9 of them will get infected.
Wow.
It is one of the most, if not the most, contagious disease out there. And so what has been happening, a combination of a number of different things, including misinformation, including we're still catching up from drops in routine immunizations that happened during COVID, as well as a number of other issues. Our vaccination rates have dropped. There also are some communities that have low vaccination rates. And what we are seeing is when there's a measles case that is in an area where immunization rates are not high, it will continue to circulate. And one thing we are really concerned about is that we will lose that elimination status, and we will be faced with having measles circulating in the U.S. on a regular basis. But there are things we can do. And what we can do is we can vaccinate, and we can ensure that our children are vaccinated. We can ensure that if people are traveling and if they don't have a history of having an MMR, they can go to their doctor and get vaccinated. It is an extremely effective vaccine. It actually is the vaccine that we compare all other vaccines to. With just one dose, 93% of people are protected lifelong.
Wow.
And with 2 doses, you can bring that up to 97%. So extremely effective vaccine. And measles is not a cold. Measles can be extremely severe. So just to let your listeners know, one reason why it is sometimes challenging to control these outbreaks is that the first signs of measles are nonspecific. They can be high fever, runny nose, cough. We can get red eyes. And then a few days later, then you get the rash that measles is known for, that begins in the hairline and spreads downward. And we worry about measles because there are some people who are at higher risk for very severe disease, including young children, including people in our communities whose immune system is not robust, including older people, including pregnant people. They are at risk for having miscarriages, premature labor, and measles, even in a normal child, about 1 in 20 will develop pneumonia. 1 in 1,000 could have a brain inflammation. And in fact, there can be long-term impact. Some people who get infected years later, could be 10 years later, may develop a syndrome. It's rare, but it can occur due to measles, called subacute sclerosing panencephalitis, which is a progressive neurological brain disease, which is typically fatal. And so we have such an effective tool. We don't want people to get this infection.
Wow, those are some jaw-dropping numbers. And it seems very scary that you could think that you have a cold or something with those generic symptoms, and before you even get those sure signs of measles, you could have exposed several other people to it. Can you tell me a little bit? We just learned that Minnesota is going to have a role in helping mitigate or something along the lines of helping Texas with the outbreak that we're currently seeing right now. Can you tell us about our role in that?
Sure, I can. And I also want to circle back because you made an extremely important point in that people can be infectious 4 days before they develop the rash to 4 days after. So absolutely, you can expose people and not even know you had measles at the time. Our public health laboratory is really such a wonderful public health laboratory. They have been really given the status of being a regional resource, and they have been helping to run specimens. One reason why that's really important is, of course, to be able to diagnose measles, but the MMR vaccine is a vaccine where you have a weakened virus. And the virus can cause a rash in some people. And by getting a sample, you can distinguish between the vaccine virus and the measles virus. So it's really important if there has, because one of the tools we use to control the outbreak is to vaccinate people, including those who've been exposed, if you can get to them within 3 days after exposure. So we are helping them with their lab support. We are running specimens for measles to detect measles. And then we're also running specimens to take a very close look at whether someone with a rash may have the MMR virus rather than measles virus.
Interesting. Wow. Thank you for that breakdown, Dr. Lynfield. I want to move on to avian flu, bird flu, H5N1. We last heard a few weeks ago about an outbreak on a farm in Stearns County. What's the latest there, and what can you tell us about bird flu statewide?
Okay. Well, just to remind folks, this latest outbreak of H5N1 began in 2022. We started to see outbreaks in poultry farms. And then in March of last year in Texas, it was recognized that there actually was infection occurring in dairy cattle. And since that time, we have seen the outbreak spread. In Minnesota to date, we have had 185 episodes in poultry impacting 9 million birds. And we've had 4 in 2025, and we've had 9 episodes in dairy cattle and 1 actually in goats in 2024. What you are referring to is a program that Minnesota is working on with USDA to take a look at bulk milk. And this is milk before it's pasteurized. And we did find in March that there was a farm that was positive. And what happens when the farm is positive is the Board of Animal Health and the Minnesota Department of Agriculture go and assess the farm and speak to the farm workers. And actually, the Minnesota Department of Health also does that with impacted farms. We give information to the workers who have been in touch with infected animals about monitoring their health, and also if someone does have symptoms, we evaluate them. It's important for people to remember that the risk to the general public is low. We have not had any episodes of person-to-person transmission. However, there is a risk to people who work with infected animals or their fluids or are in touch with their environment. And hence, we have been working in collaboration with the Board of Animal Health, with the Minnesota Department of Ag, with the University of Minnesota to provide information about how people can protect themselves. We've been making personal protective equipment available. And as I said, we've been monitoring and in some cases testing the farm workers. Fortunately, to date in Minnesota, we have not identified any people who have been infected. However, nationally, there have been 70 people who have been detected with H5N1. Most of the cases are mild. However, there have been 4 hospitalizations, and unfortunately, there has been 1 death in a person who had exposure to backyard birds who were infected. This was an elderly person with underlying conditions. So this is something we absolutely need to keep an eye on. We do surveillance for it. I mentioned the bulk milk testing. We are also testing our hospitalized patients, looking for cases of influenza A that may not be seasonal. We also are doing surveillance in wastewater for H5. And we've had a couple of detections. And when we get a detection, we investigate what may be happening. Oftentimes, it may have to do with wild birds getting into the wastewater system. However, we keep our eyes open, and that is something we will continue to do. It's important to do the surveillance and to be prepared because this virus already has jumped to so many species. So we have our eyes open.
Yes, all good information, all good reminders for us to keep an eye on this and remember that it's still going on and still having an impact around the state. Lastly,
and important to have pasteurized milk, because we do see high doses of the virus when dairy cattle is infected, but the pasteurization is very effective at killing the virus. So another good reason, in addition to all the other reasons, various enteric pathogens, to have pasteurized dairy products.
Great note. Thank you for that. Lastly, Dr. Lynfield, I do want to talk to you about these proposed public health fund cuts.
Yes.
$224 million on the line here in Minnesota. The federal government, the Department of Health and Human Services saying COVID is over. These are not funds that are needed anymore because they were allocated during the COVID-19 response fund. But now, local and state health departments are saying, no, we have used those funds and are continuing to use those funds. Tell me a little bit about that and what would be at stake if this money is cut.
Yeah, well, this is funding that was earmarked to respond to COVID and other emerging infectious diseases. And during the COVID pandemic, we did detect areas in our public health system that we needed to improve. And so a lot of that funding was used to make our public health system and our response more robust. This includes being able to work with our communities, having community coordinators go out, do education around COVID, but also around other infectious diseases. It includes working with partners to set up vaccination clinics. It includes doing things like wastewater surveillance for a variety of pathogens. It includes making our laboratory more robust and responsive. And it included also things like modernizing our immunization registry so that we could keep track of vaccinations and understand where we needed to do more outreach and more education. If I look at the areas, it really is across the department. And, people working really hard, people working with our tribal partners. Money went out to tribes, to local public health, variety of places. So we do have very significant concerns for both our ability to respond quickly and effectively, as well as our partners.
Wow. A lot on the line there, that money impacting most of us, if not all of us, as Minnesotans. Dr. Ruth Lynfield, she's the state epidemiologist and medical director for the Minnesota Department of Health. Thank you so much for your time. I hope we can check back in with you in a month or so. You're so good at breaking down all of these headlines that I know we have lots of questions about. So thank you for your time.
My pleasure. Thank you.